I'm Dr. Parsa Mohebi. I'm going to go over a few more questions about facts and myths about hair loss and hair restoration. So today's questions are mostly about female and hair loss. Question number 1. Can stress cause hair loss? The answer, yes. Stress can cause hair loss for people who don't have any hair loss history, family pattern of hair loss, and that's going to be temporarily. So if you lose your hair because of that, you will grow your hair back and get back to where you were before. However, if you have the gene of female pattern or male pattern hair loss and you're losing your hair because of the stress, that hair loss could be permanent and you may never get back to where you were before. You need to talk to a hair transplant or hair restoration doctor to see what are the other options you have and how you can restore the hair that you lost. Can I lose hair after giving birth? That's a common question and it's a fact. Many people experience some hair loss after termination or completion of pregnancy. That could be seen as shedding, excess shedding, see-through, so you can see your scalp more than before, or losing the bulk of your hair. If you just finish your pregnancy within the last few months and you see excess shedding or hair loss, you can wait a few more months, at least 6 months after pregnancy, because if you lose hair early on, you will usually resume your normal growth rate of hair, and then you will be back to where you were before after the first 6 months. However, if you are having the gene of pattern hair loss, so you're supposed to lose your hair anyway, you may just accelerate the pre-existing hair loss and you will never go back to where you were before. So in order to be evaluated, we usually recommend waiting 6 months to see any growth that is supposed to happen. And after 6 months, we do microscopic evaluation. If we see the hair loss is permanent, we can proceed with medical or surgical treatment. Hair restoration could be an option, like surgical hair restoration with FUE hair transplant. If you have the pattern hair loss, male pattern hair loss especially, that you have protected hair on the back and sides, so you can remove some of them and putting them in front, creating hairline or adding the density of the front that you lost. Do women grow their hair longer? That's not a fact. Women and men grow their hair as fast as 1 centimeter per month. So every man or woman grow hair 1 centimeter every month. And if you let it grow long enough, you can grow it to your shoulder length or to your waist, depends on your genetic. What makes it different as that how much you can grow your hair is not the speed of your hair loss, but the length of your growth phase. So each hair follicle goes to different phases. It could be growth phase, which we keep growing each hair longitudinally. After that growth phase is over, the growth stops and hair goes to resting phase. That after 4 to 6 weeks, we lose that hair shaft, and after that period, it starts growing another hair from the same follicle. So if you're genetically designed to have shorter growth phase, you may not be able to grow your hair more than your shoulder level. If you're genetically designed to have longer growth phase, your hair may grow as long as your waist or even longer than that. So men or women, it doesn't make a difference. It has to do with your genetic and how you are inherited the growth phase length of hair. Women and men are growing hair in different patterns. That's a fact. We have male pattern hair loss and we have female pattern hair loss. But the difference between female and male pattern hair loss is, although in male pattern hair loss you lose hair on the top, you have a protected area on the back and sides. On female pattern hair loss, on the other hand, when you lose hair on front and top, the back is not protected either. So there's no immune center that you can use those for transplantation purposes. So in female pattern hair loss, just like another condition that we call 𝘠𝘶𝑝A or diffuse and pattern alopecia, you may lose hair all over the scalp. These people are usually not good candidates for hair restoration procedures because there's no protected area that we can harvest hair from and transplant it to the other areas. I hope this has helped you to learn more about hair loss and hair restoration. If you have any other questions, put your comments in the section below or contact my office, and I'll be happy to answer more questions through our social media or our blog.